Sister Love is a 28-year-old nonprofit organization. We consider ourselves a sexual and reproductive justice organization with a focus on HIV and AIDS for women and their families. I started Sister Love probably for some of the same reasons that many different community-based organizations get started, and especially in the HIV/AIDS world, which was out of anger. Where I live in Atlanta, Georgia, there was nothing. There were no services. Not even within the current HIV/AIDS organizations was there education, information, or service delivery for women who were being impacted by AIDS. But more importantly, I was also involved in the reproductive rights movement at that time. In that field, HIV/AIDS, especially for women, didn't have any traction, didn't reach priority. And that's really where my anger came from, is that it's a feminist issue and it's an issue of sexual and reproductive rights. And my organization really didn't see it that way. And so it's actually when I left my job at that organization and started Sister Love. I am not HIV positive, but I live with HIV. I am HIV affected. I am HIV impacted. The fight against HIV is not just a public health issue, it's a social justice issue. It's a human rights issue. It's a women's rights issue. And I knew early on that HIV was clearly an issue in which my fight already lived. There's a fight against the virus, which is why I'm going to do my prevention work. But if I'm not fighting for people to have equal access to healthcare and to have equity quality in that healthcare, we're not going to defeat it. It's going to win every single time. Sister Love and I, we joined the Women Don't Get AIDS campaign, which was the campaign to make the CDC change the definition to include women. The reason women didn't have anything was because we weren't being counted. We weren't being diagnosed. If you can't count women, then you can't serve women. And if you can't serve women, then you're not saving our lives. Our lives matter. Intersectionality matters for women affected by HIV. Women's lives are complex, complicated, layered, with many different levels of experiences. Sexism, racism, religion, customary practices, cultural practices, language, all of these things are coming together in one human being that walks in the door who may happen to have been either born with a vagina or chose to get a new one later. We have to look at all of these issues and be intentional about tackling them all, because that's the only way we're going to tackle the HIV, because it's already wrapped up in all of that stuff. The reproductive rights mean women with HIV should have equal access to contraception, to fertility assistance, to abortion, to have the child, to not have the child, and to parent the child that they want to have. HIV is a bigger challenge for women because women are already more economically dependent before HIV even happens. However, there are studies that have shown us that for poor women or women with no and low income who are HIV positive, disclosing your HIV status and seeking services is actually an economic benefit, because you're the only folks now who have access to housing, childcare, transportation, meals delivery, all of those things that matter that you struggle for before HIV. For women of middle income and higher, HIV diagnosis is exactly the opposite. It could destroy their status, their job, their insurance coverage, how they're situated in their families. The history of violence and domestic violence for women, especially in the United States, especially for women of color, and even more so for Black women, is still untold. We have not yet figured out how to directly address that in the context of HIV and AIDS. The presence of violence drives up the vulnerability to HIV for HIV negative women. And for HIV positive women, the presence of HIV drives up the vulnerability to violence. We can recognize and honor, acknowledge, respect the fact that for this epidemic, men opened the door. Men opened the door on the advocacy, on the activism, even in the research, the policy making, all of that. But what I'm clear about is that it will be the women who close the door on this epidemic, because once women own it, we change things. And when we change things for everybody.